Thank you for your interest in Ohio University and our online Masters of Science in Nursing programs. This information session will speak to the benefits of the degree, program requirements, provide detailed program information, and also our admission process. My name is Serena Garcia. I am your enrollment advisor. My goal is to provide you with all the program information, help answer all of your questions, and should you decide that our MSN program fits your needs, assist you with the application process as well. Also with our program team, you will eventually be in contact with Chad Kopensky, our academic advisor, and Grace Billington, our student support specialist. At this time, I would like to introduce you to Dr. Shar Miller, Associate Professor and Program Director, and Chad Kopensky, Academic Advisor.
Hi, my name is Chad Kopensky. I'm the Academic Advisor for our graduate nursing programs here at Ohio University. Thanks for meeting with us in this manner. When you look at different graduate programs, a lot of students are looking for flexibility. And one of the nice things about an online MSN program is that it isn't synchronous. Students don't have to be at a particular location at a particular time. So that students who are working those 312s or students who are trying to balance family and other responsibilities and have a block of time between 2 and 4 o'clock in the morning, they can work on their coursework during that time. And our program is online. There are times where students do have to come to campus so that they can connect with faculty, connect with students, demonstrate their skills. There is an incredible amount of material in this program, and there's a fair amount of support for students as they go through both online and in person, both synchronous and asynchronous, meaning at the same time and, at 2 o'clock in the morning when you're working on things. We do have a number of different options available for our students to focus on while they're in our program. Family nurse practitioner, nurse educator, the adult gerontology acute care nurse practitioner, and the psychiatric mental health nurse practitioner. All of these are programs, populations for students to focus on as they pursue their MSN. One thing students also tend to look for when choosing programs is accreditation. Accreditation is a stamp of approval from a national body saying that a program meets certain standards in terms of their curriculum, in terms of their interaction with students, in terms of the process for students and faculty. And if you notice, Ohio University, we are accredited by the Higher Learning Commission. We also are accredited by the CCNE, which is the Commission on Collegiate Nursing Education. Now, our programs are broken down into essentially 2 years. The first year are what we call core courses. These are courses that are common to all of our different tracks. Students take 2 courses per semester, or 6 credits, which translates typically into about 20 to 24 hours of work per week within the classroom. You can see the courses that are listed there, and actually they're listed in the order the students will typically take them. And these courses all build on each other to get students the theory and just the baseline of knowledge that they will need before they go into their clinical settings. Now, the second year of the program is where students will split into their different population foci. Family nurse practitioner, nurse educator, psychiatric mental health nurse practitioner, and the adult gero program. These are what we consider clinicals or track courses. They typically will take 1 or 2 courses per semester so that they can focus on, again, the population that they are going to be focusing on. By and large, we tell students to estimate about 18 to 24 hours of work per week for the coursework, and then in the nurse practitioner tracks, the psychiatric and the adult, to also estimate about 20 to 24 hours of work per week at the clinical setting or in the clinical site. And that's something to be aware of as students look at our program, is just to understand that one of the bigger challenges is time management. It's understanding that starting a master's program is a little like adding a part-time job to your current schedule. And students typically have minimal challenges the first year during the core year, but adjusting for the track year, once they're in the clinical setting, it's something that really students should think about now. Speaking to their families, speaking to their employers, looking at the support system that's there so that they can be successful in their chosen track. Now, our admission requirements. We do accept students only from certain states. We ask the students to have a BSN from an accredited college or university. Minimum cumulative GPA of a 3.0 on a 4.0 scale, and that's over all of the, a cumulative GPA is going to be from all the institutions that you have attended. And a current unrestricted U.S. RN license. These are the things that we need in order for you to apply. There is more to the process of admission, but these are just the prerequisite things that we need in order to be considered for our program. Another consideration for students is costs, and there are different tuition rates depending on whether you're in-state or out-state, plus the program itself. Because of the nature of our program in terms of books and travel to campus, insurance, and other things, it's often hard to give a total estimate of what the total cost of your program will be, because individual costs are going to change. They'll vary over the course of your time in the program. But as you can see there, that's a good estimated total cost for our different programs, both in-state and out-of-state tuition. And now what I want to do is I do want to have Dr. Miller talk about some of the next steps as you pursue a program at Ohio University.
Hello, this is Dr. Miller, and I'll speak just a moment on our admission process. So the next steps after you have decided that Ohio University is for you, we hope that you've made that decision. We take our admissions and our students and our programs very seriously. Our selection process is just that. It is selective. We consider each and every person who applies in a holistic manner, looking at your background, your professional goal statement, where you see yourself being in relationship to the track option or the concentration that you've chosen to pursue here at Ohio University. The first step is completing the online application. So you can find information about how to access that and complete the online application. Included in that application is a request for transcripts from all colleges or universities that you have attended. So that includes not only those from which you actually received degrees, but also if you attended another institution even for a class or two, those would be required as well. You'll be asked to upload a current professional resume. So this should include, at minimum, your educational background and your current and past employment background. The professional goal statement, which will ask you to be a little bit more directive than just that. We really want to know, this is your statement to the selection committee about why we should choose you to be an Ohio University master's student. And it's really our only opportunity to peek into what you are, who you are as a person, and who you are as a nurse, and who you will be as a potential Ohio University master's student. And so we really want you to speak specifically to some guided prompts, which you'll receive at a later date in the FAQ about the program. And we also ask that you provide 3 people's names and contacts that can provide a recommendation to you, for you to the program. These people should be people who can speak specifically to the skill set that you possess that will make you a successful master's student. So the things to consider are, can these people speak to my clinical skills? Can they speak to my leadership abilities? Can they speak to my ability to communicate in both written and verbal forms? So as you're selecting those people that you ask to provide those recommendations, those are really important things to consider. And finally, you need to submit the application along with the application fee. So we hope that Ohio University is your choice. It is a very different environment from many other master's programs that you might see. Every faculty on staff here is still a practicing nurse, so we maintain active practice in addition to our faculty practice. I think that really speaks to the kind of content and the kind of understanding that you will receive in the educational process. And we also have a vested interest in you as a potential student, not just as our student, but as somebody who will join our ranks as a colleague. In particular, the advanced practice concentration, so the FNP, the AGA-CNP, and the Psych Mental Health NP, it's a really important step to transition into advanced practice from basic level nursing practice. And we take that process of educating you very seriously because you will be joining us not only as an alumni, but also as a colleague, somebody that we will look to be a leader in the field and who will help guide practice and guide clinical outcomes and patient care throughout, the rest of your future in that profession.
Thank you for taking the time and viewing our webinar. Dr. Miller, Chad Kopensky, and myself appreciate your time. If you have any questions or for more assistance, please feel free to email me at the email address provided on page 4 of this webinar. I look forward to helping you soon.